There is rule of 10 to keep your heart healthy. Number 1 is control your blood pressure. Number 2 is control your diabetes. Number 3 is control your cholesterol. Number 4 is regular exercise, which I say is at least 30 minutes of exercise a day is must. Number 5 is less carbohydrate diet. Number 6 is get rid of obesity. 7 is stop smoking. Number 8 is take alcohol less. 9 is sleep well, at least 7 to 8 hours sleep is mandatory. And something is genetics, which we cannot take care. But if we follow these protocols and this rule of 10, we can keep our heart healthy.
We are today joined by Dr. Sumitra Ghosh, interventional cardiologist, practicing in West Bengal across Durgapur and Bardhaman.
Aortic valve, when it is stenosed due to deposition of calcium and all that, in the past there is only one treatment, open heart surgery and replace the valve. But recently, TAVI, transcatheter aortic valve replacement, has come in a big way. So we make just a little bit puncture in the femoral region and we assess the valve and easily replace the valve, and patient can be discharged in the next day. Patient life longevity is increased, patient symptoms is decreased. So definitely TAVI is the one most important thing in the recent advances.
One myth about advanced cardiac treatment you would like to burst.
Most of the people think that once procedure is over, once surgery is done, they don't need to take any medicines and then need not to follow up to the doctors. But that is absolutely wrong. You have to follow the doctor's advice, you have to take the medicines, and you have to regular follow up to doctors and listen to what doctor says. Most of the people don't do it. If any kind of chest pain or even chest discomfort is there, you should go immediately to doctors and get your ECG and echo and all that thing to be done. When we see after surgery, patient is getting well, as patient smiles, and patient is going home after major surgery, that is a great satisfaction.
Hello and welcome to the Voices of Cardiology, brought to you by Voice of Healthcare in collaboration with Polymedicure. This series focuses on simplifying heart health for patients and families, where India's leading cardiologist will share some practical insights, real-world experiences, and advancements that are shaping the modern heart care in our country. In this episode, we are going to discuss about the complex cardiac conditions. Patients who were once considered high risk or difficult to treat now have access to advanced technologies and techniques that are making the procedure safer, more precise, and more effective. So, to help us understand these advanced modalities in managing complex cardiac patients, we are today joined by Dr. Sumitra Ghosh, a young, dynamic interventional cardiologist practicing in West Bengal across Durgapur and Bardhaman. Dr. Ghosh completed his DM in cardiology from PGI Chandigarh and is currently associated with Sharanya Hospital, Bardhaman, and Gauri Devi Hospital, Durgapur. His specialities is in complex procedures including complex PCI, CTO management, calcium management techniques, and dual chamber and leadless pacemaker implantation, and advanced coronary imaging. Thank you so much for joining.
Thank you.
To begin our conversation, when we say the complex cardiac patients, it can sound overwhelming. So can you help our audience understand that who falls into this category and why their treatment is more challenging?
Yeah. So question is, what are the complex cardiac lesions rather than complex cardiac patients? So complex cardiac lesions are lesions which when we going to intervene, it's not like day-to-day lesions like which I treat. So for the coronary lesions, there are three main coronary arteries in our heart. So if there is narrowing there, chest pain occurs, and when it is 100% occluded, heart attack occurs. So we have to treat the lesions. So treat the narrowing part. So in the general sense, when it is complex, when some of the features are there. Number one is when the narrowing is from the beginning of the artery, where it is arises, the narrowing is there only from the beginning. So this is called ostial lesion, number one. Number two is left main lesion. There are one main artery in the left side from where two main arteries arises. So, and these left-sided artery, left main coronary artery, supplies almost 80 to 90% blood to our heart. So when left main coronary artery is occluded, whole of the arterial system is jeopardized. So left main coronary artery stenosis is called complex. Number three is bifurcation lesion. Bifurcation is called when main artery divides into two. This is called bifurcation, or divided into three called trifurcation. So when bifurcation or trifurcation lesion is there, narrowing is there, that is called complex. Number 3. Number 4, when artery is 100% occluded, chronic total occlusion, 100% occluded for many months or many years, that is called chronic total occlusion. That is a complex lesions. Number 5, when artery have thrombus. Thrombus means blood clot. So that is a complex lesions. Number 6 is when artery have calcium in the narrowing part. Calcium means there is पत्थर जम जाते हैं वहाँ पे. So severe or moderate पत्थर अगर जम जाते हैं, so that is also called complex. Or after bypass surgery, the venous graft is occluded. That is also a complex lesions. So that is for the coronary artery lesions. For structural perspective, structural point of view, structural heart disease, hypertrophic obstructive cardiomyopathy, there is a condition where heart muscles get thickened. So that is also a complex heart disease. For valve disease, valves is narrowed, like aortic valve narrowed, or mitral valve narrowed, or mitral valve is leaking. These are also come under the complex heart disease category.
Thank you, sir, for explaining us that in a very simple language and to understand what exactly is complex cardiac conditions.
Yeah.
So, since we're talking about the cardiac conditions, and we know that advancements in technologies has, paved the way, and cardiology has also evolved rapidly. So, what are some of the most advanced technologies today that are improving the outcomes of these complex heart patients?
Yeah. In the past, there is only one solution for heart disease, that open the chest and fix the problem. But day by day, all these problems are fixed by percutaneous route with microsurgeries, which is called. Patient, हम लोग पेशेंट को बेहोश भी नहीं करते हैं, पेशेंट को कोई एनेस्थेशिया नहीं देते हैं, सिर्फ एक आर्टरीज में छेद करके हार्ट में पहुंचते हैं एंड वहाँ पे जाके हम लोग वो ट्रीटमेंट करते हैं. सो दैट इज द मेन थिंग. So this is called percutaneous coronary intervention for the coronary artery disease. And for this coronary part, we have many advancement day by day. Like recently, there comes a DCB, drug-eluting balloon. Previously, there is, whenever coronary lesion is there, we put a stent there so that artery is opened up and keep it open. But nowadays, we want metal-less coronary, so we don't put stent there. We go there and just inflate a balloon which is coated with drugs, which is coated with medicines, and we inflate that and balloon is removed. So that medicine part, the drug is inside the drug is attached inside the coronary artery, and it acts like it keep the artery open. So there is no metal inside the artery. So there is a great advancement of in the cardiology. Number 1 is which I talked it, drug-eluting balloon. Number 2 is even in stent, coronary stent, there is many advancement like thin struts, so that we can easily go there and fix that, and less thrombus will be formed later if it occurs. And for the pacemaker part, we have Micra or Avier. That is in the past. For the pacemaker, in the pacemaker there are two parts. One part is that device which is put under the skin here over the muscles, and two wire are put through that inside the heart. So in the recent advancement, we only put a capsule like pacemaker, and no wire or nothing is there. We just put a capsule like pacemaker inside the heart, and that is all. That is the pacemaker. It functions like pacemaker for all. So that is called leadless pacemaker. That is a great advancement. Number 3 is for the aortic valve stenosis, aortic valve narrowing. We have TAVI. So that is a great advancement for the recent years.
I think so. These are the advancements, or how it works. We were not aware of it, and thank you so much for explaining us that. And whenever we talk about the complex cardiac cases, many patients fear the complicated procedures because they do not know what is happening.
Exactly.
Only the doctor is aware, or the team is aware about it. So, how have the modern advancements made the heart treatment safer and less invasive compared to the earlier times?
As I said, in the previously, there is only one solution: open the heart and fix the problem. So there are many complications there. Number 1 complications: when you open the heart, there is more chances of infections, more number of days you should stay in hospital. And there is also a risk for general anesthesia. Patient को बेहोश करते हैं, उसका एक risk होता है. So all that complications is taken care, is alleviated by the percutaneous approach. We do not anesthetize the patient. We just गिव ए लोकल एनेस्थेशिया, जस्ट वहाँ पे एक लोकल एनेस्थेशिया देते हैं, फिर वहाँ पे एक हार्ट में आर्टरी में छेद करते हैं और वी go to the heart and fix the problem. So this is called percutaneous procedure, all that we do. And for that complex procedures, we do it regularly with great precision and all that with recent advances. So that part is very important.
Thank you so much, sir, for explaining us that. And moving on to my next question, when we hear about terms like imaging, calcium management, or advanced stenting, so how do these newer tools helps doctor make a better decision and improve the treatment success?
Yeah. So imaging is very important in our cardiology practices. So there are two types of imaging, non-invasive imaging or invasive imaging. Non-invasive imaging means we do not puncture the patient's artery or all that, like CT scan of the heart, MRI of the heart, coronary CT angiography. Coronary CT angiography is coming in a big way nowadays. With the CT scan, injecting some dye inside the coronary arteries, inside the heart vessels, we get to know how much percentage of blockage is there, whether calcium is there or not, and how to treat it, we can decide it. Number one, these are called non-invasive imaging. In invasive imaging, during coronary intervention, when putting a stent, we do imaging of the artery. Over a wire, there is small ultrasound probe is there, and we go inside the artery and we image inside the artery as a whole. Where is the narrowing is there, narrowing part is formed by which how much lipids, how much fibrous tissues, whether calcium is there or not. So this is called intravascular ultrasound, IVAS. So and after putting the stent there, we can easily assess whether stent is properly apposed, properly inflated or not, whether we should get more balloon inflation there or not. We can all know that. So invasive imaging number one is intravascular ultrasound. Same thing is also known by OCT, optical coherence tomography, which is called. Same thing is known but different modalities. And in recent years, NIRS, near infrared spectroscopy is coming, which we can know how much lipid is inside the coronary lesions and all that. So these are the some non-invasive and invasive imaging, which is very essential part of our day-to-day practice. And for the calcium management, what happens inside the coronary artery when there is narrowing, for if the lesion is if the narrowing is for the long term, for long years the narrowing occurs, calcium is deposited, and वहाँ पे वो जो narrowing होता है वो hard बन जाता है. So literally it when we if we do not modify the calcium, if we do not crack the calcium or remove the calcium, we put a stent, it will not properly apposed. And if it not properly apposed or not properly opened, there is a chance of restenosis there. Restenosis में दोबारा भी वो narrow हो जाना. तो इसके लिए हम लोग क्या करते हैं, वो जो कैल्शियम जो वहाँ पे जमा होता है उसको हम लोग तोड़ते हैं. Literally we drill the calcium or we crack the calcium by various modalities. Like rotational atherectomy, there is a diamond bar in the front of the bar, in the front of the wire, and this diamond bar is rotating, and it literally drill the calcium and remove it. So this is rotational atherectomy. Orbital atherectomy, there is a diamond bar in the rotational atherectomy, there is a diamond bar in the tip, but in rotational atherectomy there is diamond bar in the side, so it rotates on its own. So, and by doing this it cracks the calcium, also some remove the calcium also. So this is orbital atherectomy. Number 3, intravascular lithotripsy. So we put a balloon there and give sonic waves, ultrasonic waves. So by sonic wave, bubbles are formed inside the balloon, which with a great pressure, it crack the calcium. So these 3 types of modality. Number 4 is laser. Excimer laser is used to crack the calcium. Number 5 is some balloons are there, like scoring balloon, cutting balloon. Scoring balloon is, there is wire which is score the calcium, and for the cutting balloon, some blades are placed over the balloon, which literally cut the calcium. So these are the some modalities which is complex, which we do in day-to-day practice, and by which calcium is modified and put the stent and it properly apposed.
So I think these are something which is not much known about by our audience, and if it would be great if you could just elaborate more on this.
Lesions, these where fibrous tissue or lipid, calcium is deposited there, and this becomes hard. So this when if we do not modify the calcium and that fibrous tissue and we put the stent, then outcome will be not good, because stent will not be apposed properly and it will not open properly. So the long-term outcome is not good. Stent will be again narrowed, stented area. So calcium should be debulked. Like if you कभी कभी जो इसमें हम लोग ड्रिल करते हैं पत्थर में, like that we drill the calcium out to remove it or crack it so that it can be opposed. So different modalities to crack the calcium is like that, which I say 6 types of modalities. These are all modalities used different. Like in rotational atherectomy, there is a diamond bar in the front. So when it rotates, it's literally drill the calcium through and through. Number. And for intravascular lithotripsy, there is sonic wave, which sonic wave just hit the calcium outside and it cracked it. And all these modalities literally do the same, cracking the calcium and making the room.
I think that is exactly something which I was trying to mention, that which a normal public that is not aware about
Aware of
it,
that.
and how complex these things are.
Is actually.
So, since we're talking about the public awareness and how things are not clear to them, so from patients and families, when they have to make a decision about which approach to go for, whenever the doctor says about the complexities or these are the solutions, this sounds a little confusing to them. So, how should one choose the right treatment approach or hospital when dealing with a complex heart condition?
Yeah, very good questions. So, patient relatives should see few features, like which hospital should they go for the treatment of these complex lesions. Number one is volume of the cases doctors do this complex type of, how much volume per month doctors are doing this type of cases there. That is the most important thing. They should be acquainted with all this procedure frequently. So number of complex cases they do, and how success rate is, how much they should know that. Achha. Number 3 is heart team approach. Usually big hospitals, successful hospitals have heart team. There is not only cardiologist, cardiothoracic surgeon, anesthesiast, and all that make a team and decide how to do. So whether heart team approach is there or not, whether hospital is NABH or FCI accredited or not, that is very important. And this is, and how whether they have high-end cath lab machines, state-of-art cath lab machine and cath lab facilities, high-end CCU setup or not. All these should be taken into consideration when patient relative take the decision.
I think that's a very valid point, because at the time of emergency, these things are not being thought by anyone. They
literally.
just go to the first doctor.
Nearby hospitals. But these, for emergency purposes, they should go nearby hospitals. And from there, they should be triaged. Which hospital should they go for ultimate treatment or not?
So these factors should be considered.
Should be considered for elective cases at least.
So, and looking at the future, when we talk about the future of healthcare or specifically the cardiology, so what is that one innovation or advancements in cardiology that excites you the most and that can truly change the patient care in India? And you're looking forward to that also.
Yeah, it's definitely TAVI. TAVI means we have 4 valves inside the heart. So aortic valve, when it is stenosed due to deposition of calcium and all that, in the past there is only one treatment, open heart surgery, and replace the valve. But recently, TAVI, transcatheter aortic valve replacement, has come in a big way. In the past, old ages patient or high risk patient were not touched even by cardiac surgeon. In the 80s or 80s years old or 90s years old, patients have many comorbidities. Usually surgeon even didn't touch the patient because of fear of death on table. That patients are easily taken care of now with we make just a little bit puncture in the femoral region and we assess the valve and easily replace the valve within hour. And patient can be discharged in the next day. That is and patient's life time is, patient life longevity is increased, patient symptoms is decreased. So definitely TAVI is the one most important thing in the recent advances.
I think that if that is solving all the complexities, it is a great tool.
A great tool, definitely.
So with this, we move forward to our next segment, which is a rapid fire round. And I have some questions, and for that, I would expect some rapid fiery answers from you. So starting with when one advancements in cardiology that truly transformed the patient outcome.
Previous questions, this is TAVI.
TAVI.
TAVI only.
And one common fear patient have before a complex heart procedure.
It's definitely, if in any procedure, is the fear of death
Okay.
in the perioperative period, during or after. This is the most important thing which patients consider at that time.
And how do you deal with that?
पेशेंट को समझाते हैं अच्छे से जे रिस्क तो थोड़ा होता ही है, बट देयर इज सक्सेस रेट इज मोर देन fear of complications. So just do it. We will take care of rest of the things.
Correct. One myth about advanced cardiac treatment you would like to burst.
Most of the people think that once procedure is over, once surgery is done, they don't need to take any medicines, or then they are almost fine and then need not to follow up to the doctors. But that is absolutely wrong. You have to follow the doctor's advice. You have to take the medicines, and you have to regular follow up to doctors and listen to what doctor says.
I think that follow-up and following the prescription is
very
must.
important.
One simple habit that can prevent heart complication in the long run.
So definitely I say at least 30 minutes of moderate amount of exercise, moderate intensity of exercise is must to keep your heart healthy. This is the easiest way. Among various ways, this is the easiest way one can adopt this, and which most of the people don't do it. So at least 30 minutes of moderate intensity exercise, your heart will be healthy for sure.
One sign or symptom people should never ignore, even if it is minor.
Definitely it is chest pain, or rather chest discomfort. Sometimes, and most of the times, we see that patients ignore that symptoms, taking it like it's because of acidity and all that. But that is the precursor of heart attack. So if any kind of chest pain or even chest discomfort is there, you should go immediately to doctors and get your ECG and echo and all that thing to be done.
After a long day, what gives you the most satisfaction as a cardiologist?
So good question. So only and only patient's well-being. And when we see after surgery, patient is getting well, as patient smiles, and patient is going home after major surgery, that is a great satisfaction. Cardiology is gratifying result, gratifying subject. Where we I have 4-5 patients who literally was dead at that time, but after CPR and all that, I personally and our team revived the patients, and that those patients are regularly coming to me for checkup even after 2-3 years. So that's a huge satisfaction for us.
That's the most wanted revenue for a cardiologist after that.
Ekdam, bilkul. That is the most gratifying.
Thank you so much, sir, for that answers. And before we let you go, I need the short closing message as a message for our public on how they can take care of their heart.
My message is very clear. There is rule of 10 to keep your heart healthy and make it stronger day by day. So this rule of 10 is, number 1 is control your blood pressure. Number 2 is control your diabetes. Number 3 is control your lipids, control your cholesterol. Number 4 is regular exercise, which I say is at least 30 minutes of exercise a day is must. Number 5 is less carbohydrate diet, eat less. The less you eat, more you live. This is the dictum. Number 6 is get rid of obesity, regular exercise and through diet. Number 7 is stop smoking. Number 8 is take alcohol less. You can take alcohol, but it should be not more than 1 peg per week to be said. 9 is sleep well, at least 7 to 8 hours sleep is mandatory. And something is genetics, which we cannot take care. But if we follow these protocols and this rule of 10, we can keep our heart healthy. So this is the message to the public.
I think that's a very crisp and concise message on what to do and what not to do for a healthy heart. Thank you so much, sir, for all those insights and expertise you have shared with us.
Yeah.
It means a lot to educate and aware our public out there who are listening to us.
Thank you.
Thank you so much.
Thank you.